Okay, so let's talk about something a lot of people have heard of, but maybe don't fully understand: cortisone shots. We're going to break down what they are, how they work, and most importantly, where they fit into a bigger plan for your health. Let's get right into it. You know that feeling when joint pain just takes over your day? It dictates what you can and can't do. It's this constant nagging thing in the back of your mind, and naturally, you start wondering, is there a simple fix? Could a cortisone shot be that magic bullet I'm looking for? So, first, let's just really sit with that reality for a second. The day in, day out grind of living with this kind of pain. Yeah, it's way more than just a simple ache, isn't it? It can stop you from taking a walk, playing with your kids, or even just getting through a workday without wincing. That frustration, those limits it puts on your life, that is exactly why people start looking for powerful, fast-acting options. And these shots are used for a whole bunch of different inflammatory conditions. We're talking about everything from the wear and tear of osteoarthritis to the intense inflammation you get with gout or tendinitis. Basically, if there's inflammation in a joint, your shoulder, knee, hip, you name it, this is a potential tool in the toolkit.
So what exactly is in that needle? Let's pull back the curtain and look at what this medication actually is.
Honestly, this is the perfect way to think about it. You know, instead of taking a pill that goes through your whole system, this is like sending in a specialized team of firefighters directly to the blaze. It's a precise, powerful attack right at the epicenter of the problem. The secret sauce is a corticosteroid. And no, this isn't some totally alien chemical. It's actually a man-made version of cortisol, which is the anti-inflammatory hormone your own body makes when it's under stress. So the shot is basically giving you a much, much stronger and more concentrated dose right where you need it most. Now hold on, because this is a super important point. When people hear the word steroids, their minds often jump to anabolic steroids, the kind used to build muscle. These are completely 100% different. Corticosteroids fight inflammation. Anabolic steroids build muscle. One mimics your stress hormone, the other mimics testosterone. Not the same thing at all. All right, let's get down to the nitty-gritty. What actually happens when you get one of these shots? And what are the real pros and cons you need to weigh? You might be surprised by how quick and simple the whole process is. First, they clean the area really well to prevent any infection. Then, your doctor will probably use a local anesthetic to numb everything up. Sometimes it's even mixed right in with the cortisone. And then, finally, the injection itself, which honestly just takes a few seconds. And this lays out the central dilemma perfectly. On the one hand, the upsides are huge. Really fast, powerful pain relief. It can even help your doctor pinpoint exactly where the pain is coming from. But on the other hand, you have to consider the potential downsides. While they're less common, they can be serious. Things like damage to cartilage, weakening tendons, or a small risk of infection. It's that classic risk-reward conversation you have to have. Now, one thing to be ready for is what's called a cortisone flare. It sounds a little scary, but it's pretty common. Before all that wonderful relief kicks in, you might actually get a temporary increase in pain for a day or two. It's totally normal, and it doesn't mean it's not working. It's just the medication crystallizing before it gets absorbed. And this number is maybe one of the most important things to remember. Because of those potential long-term risks to your tissues, doctors are very careful about how many shots you can get in the same joint. The general rule of thumb is no more than 3 or 4 per year in that exact same spot. This is definitely not a treatment you can just keep getting over and over again. Okay, so this brings us to a really critical shift in how we think about this. A cortisone shot isn't a cure, it's a tool. It's just one piece of a much, much bigger puzzle. And listen, this isn't just an opinion. Major health organizations all over the world are very clear about this. Injections are a secondary option. They are not the place you start. Why? Because while they're great at calming down inflammation, they don't fix the underlying reason the inflammation was there in the first place. So what should come first? Well, it's all of this stuff. We're talking about things like targeted exercises to make the muscles around the joint stronger, managing your weight to take pressure off, maybe using a brace. These are the foundational, long-term strategies. The cortisone shot can be an amazing bridge. It can knock the pain down enough so that you can actually do these other therapies effectively. So ultimately, all of this leads to one place: you and your doctor sitting down together and making a smart, informed decision. So use this. Go into your next doctor's appointment ready with these kinds of questions. Don't just ask for a shot. Ask how it fits into the long-term plan. Understanding the bigger picture, the risks, the benefits, the alternatives, that's what makes you a true partner in managing your own health. And that's really the final thought we want to leave you with. A cortisone shot can be a fantastic tool for short-term relief. There's no doubt about it.
But it's not the whole story. The real win is figuring out a sustainable long-term strategy. So what's that going to look like for you?